Good morning and welcome to this month's edition of Healthy Together Mississippi Third Wednesday Parent Resource Chat. My name is Bettina Campbell and I am the Social Service Coordinator and a Medicaid CHIP Assister for Oak Hill Regional Development Corporation, which is the parent cooperation for Healthy Together Mississippi. Joining us as usual today is our Technology and Metrics Director, Mr. Thomas Duke Robinson. So we want to recognize our Executive Director, Dr. Michael O. Miner, and our Program Director, Lottie Miner. Our webinars are designed to ensure that we provide current and relevant information and resources that uplift and equip parents and other child care providers with practical tools, timely resources, and faith-rooted encouragement. So we encourage you to share our Healthy Together Mississippi Facebook page, our website, www.healthytogetherms.org, and stay tuned for exciting new changes and announcements. So in February, it serves as a concentrated period to raise awareness, education, and public and promote preventive health measures across multiple health topics, and we provide opportunities for individuals and communities to take meaningful action. Today, we're going to share about Heart Health Month, which is a national-wide observance to raise awareness about cardiovascular health and the prevention of heart disease, including in this campaign is National Wear Red Sunday, which was February the 7th. And it's a national campaign aimed at increasing the awareness of the impact of heart disease in women's health. Heart disease is the leading cause of death for women in the United States. Nearly 45% of the women over ages 20 in the United States are living with some form of cardiovascular disease, such as high blood pressure, coronary heart disease, stroke, and heart failure. And that happens even if they're not aware that they are developing these symptoms. So again, that's one of the good reasons why you should make sure that you're doing your yearly checkups. The NBC, another initiative is the National Baptist Convention USA Hope Initiative. And it's we call it the NBC USA Hope Wear Red Sunday, which was last Sunday, February the 15th. And during that time, the churches that are members of the NBC USA or National Baptist Convention USA, we wear clothing such as we wear red that Sunday and other accessories to support the cause. We share our information through not only our church, but also through our social media. And we donate to organizations that focus on heart disease and research. And the one that we're going to really focus on today is National HIV/AIDS Black Awareness Day. And so what we do is it's always on the 7th of February, and it is meant to highlight the disproportionate impact of HIV in Black and African American communities in the United States. We first observed this in 1999 to highlight the importance of the community being involved and to improve access to HIV education, prevention, testing, and treatment services. So I wanted to give you some statistics or some information relative to Mississippi. So I was doing my research and I found that Mississippi is has one of the highest HIV prevalence rates in the United States. It consistently ranks in the top 10 for new infections. We have the 6th to the 8th highest rate of new diagnoses in the nation. The burden is highest among Black individuals and young adults aged 20 through 29. The epidemic is heavily concentrated in the South, with Jackson, Mississippi having one of the highest HIV diagnoses in the United States. Now we bring it closer to where we're located in northern Mississippi, and we find that the greater Memphis area, which includes northern Mississippi and northern Arkansas, and in particularly Shelby County, ranks second in the U.S. for new HIV/AIDS infection rates, trailing only behind Miami, with roughly 7,550 people living with HIV in the region. Infections are concentrated among Black men with 50% rise in cases among the 15 to 24-year-olds. And I'm sure that Dr. Anula, did I pronounce it right, Doctor?
Animalo.
Anula, will tell us more about that. So overall, the South is the epicenter of the HIV epidemic, and it accounts for 52% of all new diagnoses in 2023, despite only being 38% of the population. So today we have Dr. Anula and Mr. Denford Galloway, who are going to talk to us more about it. And I will tell you just a little bit more about who they are and the efforts that they are spearheading to highlight the progress of HIV testing and prevention and treatment efforts in an ongoing challenge to prevent HIV transmission among Blacks in the greater Memphis area. So again, remember that includes northern Mississippi as well as northern Arkansas. But before we get started with the presentations, I want to encourage you to please share this webinar on your social media platforms. And then I want you to take your pencil and paper and make sure that you are ready to take notes and write down any questions that you might have, because we want to make sure that during the presentation or immediately after the presentation that we answer any questions that you might have about today's presentation. So our first presenter is Dr. Anula, and she is a double board certified infectious disease, HIV specialist, and internal medicine physician. She is currently an associate professor at the College of Medicine Division of Infectious Disease at the University of Tennessee Science Center in Memphis. And she also is an infection attending physician for Methodist University Hospital in Memphis, where she also serves as the medical director of infectious disease and geographic medicine for Methodist Lebrana Healthcare Memphis. I know I threw a new term at most of you, geographic medicine, so I want you to go Google that and see all the work that this busy woman is doing. She is very, very busy here. And we are so proud to be able to have her on our show today. We wanted to make sure that you know that she is the recipient of the Healthcare Heroes Award in the community in the outreach category that's organized by the Memphis Business Journal. And she also has a 2020 award in volunteerism for community outreach by the American College of Physicians, the Tennessee chapter. She's very compassionate, and right now she's busy fighting this war against the rising rates of new cases of HIV among teenagers. And she said that she's going to churches and to schools and other organizations to make sure that these young people get the information that they need in order to be able to protect themselves. And by the way, we focus on young people, but hey, we old people need that information too. So go, if you find out, look to see where she's doing a presentation, or actually I can give you another show that she's doing, because she has a radio, she's the host of the hit medical show, Medical Class 901 with Dr. Chai. It's a talk show that addresses various infectious diseases that affect Tennesseans. And she says she's regularly featured on various TV stations and newspapers and magazines in Memphis, where she is a medical contributor. She's well known in the community and as an activist and a volunteer in multiple organizations that serve the poor and the sick in her community. So again, welcome, Doctor.
Thank you. All right. Thank you, Ms. Bettina, for having me on the show. I'm very honored to be here, and also Dr. Mr. Galloway, whom we've met before. He's a phenomenal man, and I'm so happy that we have him here with us today. So I'm going to start by sharing my screen. I'm going to talk about HIV, just the basic information that everyone should know that will help us understand what this infection is, what it stands for, how we can prevent this, and, treatment modalities. So let me start.
So Doctor, before you get started, let me ask you, even though I gave my best, I know I did not pronounce your name accurately. So would you please, so that people will know how to pronounce your name correctly?
Oh, my name is Dr. Chinelo Animalo.
Animalo.
Yes.
Thank you.
Okay. So I'm going to share my screen. All right. So, can you still hear me?
Yes.
Okay. All right. I do not have any financial disclosures. And so I'm going to just talk briefly about the natural progression of HIV. Start by saying what HIV is, or, we talk about HIV, we talk about AIDS. So HIV stands for human immunodeficiency virus, and this is the virus that causes the HIV infection. And I will talk about the progression and what it means. So this graph here is just showing what the natural progression of HIV is from the time of primary infection to the point where we call the clinical latency, where there's nothing going on, no signs, no symptoms, and to the point where it gets to AIDS. We all hear about it, say, hey, somebody has AIDS or what. What does AIDS mean? That's the advanced part of the HIV. So you have the acute infection, which is the very first, the time of, somebody being infected. So acute infection stands for that time period where the infection is new. It's going to the body and it's spreading through the body and infecting the cells. Let's talk about how HIV actually works in the body. What does it do? HIV itself actually does not kill. What kills is that it destroys the body immune system. The immune system is that part of the body that helps us fight all sorts of infections and keeps us safe. So what this virus does is to attack your immune system, destroy your immune system, and therefore your body is no longer able to fight simple infections. And so that's kind of how it works, just to put it very, in a very simple manner. Then after that period of primary infection, which will last for a couple of weeks, then you go into what we call the latency period. In this period, there's nothing wrong with you. Like, you don't have any symptoms, you don't, there's no fever, headaches, this, that. There's absolutely nothing wrong with you. And so what happens is that you can actually have this infection and have no idea, like zero idea that you have this. The acute infection, you might have what we call like, flu-like symptoms. You might think you have the flu, you just don't feel well, maybe low-grade fever, mild sore throat, body aches, and you'd be like, maybe I walk too much, or I have a little flu, and then it goes away after a couple of days, and after that you're good, right? And so you go into the latency period where you have no symptoms. And this can last anywhere from 5 to 10 to 15 years, and for some people up to 20 years, where there's nothing wrong in terms of infections or anything. And then you get to that point where we call the end stage AIDS, the acquired immunodeficiency syndrome, which is the end part of HIV, where if you don't treat, then that person is going to die. So let's talk about the risk factors for HIV. The commonest will be through sexual intercourse, having vaginal or anal sex or any other forms of sex with someone who is HIV positive or whose HIV status you have no idea. Sharing needles or syringes, maybe using drugs, cocaine, heroin, or even some people that maybe have to take insulin from diabetes, and you share your needles. You can't share your needles with someone else. So that would be another common way to contract HIV. When exchanging sex for money or drugs, having other STDs, things like syphilis, gonorrhea can also predispose you to contracting HIV. Then, if you have blood transfusions from a donor who has not been tested, this would be very rare here in the United States, simply because we screen the bloods that we donate. And when people donate blood, they're screened for HIV as well as other blood-borne infections like hepatitis B, hepatitis C. So it's going to be very rare, but it's still possible in some, developing parts of the world. Then you have what we call vertical transmission from mother to child. This is also rare, but you will see this in a woman, a pregnant woman who is HIV positive and probably did not know she was positive or did not seek antenatal care and therefore was never tested. And she passes it on to her unborn baby during the process of childbirth. Then, for those of us that work in the medical field, occupational exposure or needle pricks injury, maybe trying to draw blood from somebody with, uncontrolled HIV, and you accidentally, have a needle prick or cut, for surgeons or something. So you could have that from occupational exposure. So is not transmitted. So I just kind of wanted to, some of the myths that is out there to say, hey, when you, kiss somebody, you can get HIV. No, or for, from saliva, from sharing dishes or, silverware, from tears, from sweat, shaking hands, through the air, sharing toilet seats. These are not ways you can get HIV. And I wanted to put it out there because sometimes people think, oh my God, I hug somebody or I shoot somebody's son with HIV and now I have HIV. No, that's not how it spreads. So I thought it was important to kind of dispel some of those myths. So very rare ways of HIV transmission, oral sex, again, occupational, we talked about that, biting and, deep open mouth kisses, unless you have wounds, somebody's bleeding, you're bleeding. I mean, there has to be some kind of, um, exchange of bodily fluids, blood, or other ways for this to happen. So it's very rare to see that. So Miss Bettina already, spoke about, HIV diagnosis in the U.S., in terms of race and ethnicity, and you can see here that Blacks or African Americans have the highest rate in the country, and this is followed by the Hispanic or Latino people. And this is really very dear to me because in clinical practice, this represents exactly what we see in the hospital setting. Then, if you look at the HIV infection also amongst female adults and adolescents, you're also going to see that Black women are at the top. We have the highest rate in terms of race and ethnicity, and also followed by Hispanic and Latino women, and then the other races do fall behind. So look at that gap between the purple line on top, between the Black and African American women, as well as the rest of the races. So here again, basically talking about transmission of HIV. The highest rate, as was mentioned by Ms. Bettina, would be male-to-male sexual contact, and then heterosexual, that's male and female. But the highest will always is the male-to-male transmission. Then the perinatal HIV, where I had mentioned about passing this virus from a positive mother, a HIV positive mother, to the unborn baby, is also 65% of cases reported was seen in the Black or African American community. So basically amongst our women and also our children. Gay and bisexual men are the population most affected by HIV, and also this is something that is also important to note. If you look at this chart, also this is all from the CDC. You will see here that even amongst this population, the highest percentage is also seen in the Black and African American community. So when you talk about the male-to-male sexual contact, also is also highest in our community, in the Black community. So let's talk about testing. So I had mentioned that that initial part, the acute HIV, and then the latency period, these are the periods that you don't even know you have any infection, right? So what do we do? How do I know? I myself, Dr. Animalo now, how do I know that I don't have HIV, or the person next to me, like what do we do, right? So the recommendation by the CDC is that we start testing anyone between the ages of 13 and 64 for at least one time. So we will recommend or indicate testing if you have a new sexual partner. So before you become intimate with your partner, regardless of if it's male to male, female to female, male to female, whatever it is, it doesn't matter. But if you're going to go into a new relationship and that you anticipate you will be sexually active, it's important that you and your sexual partner get tested. Then if you have a partner who is HIV positive and you're not using any protection, you also need to get tested. Now we will talk about the treatment where if you're well controlled, then all that would not matter. But we're talking about if you do not know the HIV status of your partner, or if they are HIV positive, they're taking their medications and having remaining virally suppressed. These are very important facts. Then, if you engage in high risk sexual behavior, if you have multiple sexual partners, if you're not using any kind of barrier protection, or anything that will put you at risk, again, engaging with people you don't know their status. So we always say, hey, what's your status, are you tested? Then IV drug users, if you're using IV drugs, cocaine, heroin, whatever it is, shooting drugs and all that, is very, very important to know your status. And then, if, of course, it's worse if you're sharing needles. So these are very, very important risk factors. And then pregnancy. For every pregnant woman, part of the antenatal care that a pregnant woman gets would be, to test for certain types of infection that would affect the baby, including HIV, syphilis, gonorrhea, chlamydia, hepatitis B, hepatitis C. These are all infections that you could transmit to the baby just directly from childbirth. So if a woman is going through antenatal care, the chances are that she's going to get tested. And if for any chance, the woman is pregnant, then the doctors are going to try to put her on some HIV medications to control that infection so that it's not passed on onto the innocent baby. So there are different types of HIV tests out there. The commonest one is going to be the blood test that that is done in your doctor's office. So if you go to any health fairs and stuff, then we have the saliva test that you can get off the shelves from Walmart or Walgreens. So I'm not going to go into the false positive or false negative test, but that can occur. But in very rare cases, this is something we can talk about another time. So, what are the greatest challenges in HIV? Is getting tested. This is the most important thing in HIV. And I can't stress this enough because you can't treat what you don't know, right? And the only way for you to know is to get tested. So we're encouraging everyone. I know that I think in March there's going to be a health fair. Miss Bettina will talk about that a little bit more. You can go to if you live in the Memphis, greater Memphis area, you can go to your health department. If you live in Hernando, anywhere in Mississippi, you can go to your nearest health department and get tested for free. You can go to your doctor's office, or you could go to other places. The walk-in clinics they have at Walgreens, but get tested, know your status, because you cannot do anything. You cannot save yourself. You cannot save your partner. You cannot live if you do not know your status. Are you positive? Are you negative? That's the question that matters the most, because that would determine which way to go. Then let's talk about stigma and discrimination. This is something Mr. Galloway is going to talk to us about, but this is really something, as somebody, as a physician that treats HIV, patients, this is something that really worries me to the depth of my core, because we tend to stigmatize HIV and tend to, kind of look down on people who are HIV positive, and that's part of the problem. HIV now is like a chronic illness. It's just like somebody with diabetes, with hypertension, with, heart failure, other things. You don't go around, snaring at somebody else or being like, oh, what did you do to get this infection? It could be me, it could be you, it could be anybody. And this stigmatization is worse in the Black and African American, community, and it comes with discrimination. And so this is something that we need to work together as a group, as a people, and understand, because if we understand what this infection is, then it will be less, criticizing and other ways. So this is something that really bothers me, and we will talk about it a little bit more when Mr. Galloway talks to us. Another thing will be non-adherence to medication. So now let's say that somebody's HIV positive. What are we going to do, right? We will put you on medications immediately to get virally suppressed. What does this mean? It just means that we come to that point where the infection is controlled, It's very let me chime in here and just say something real quick, okay? There is no cure currently for HIV, but we can control it. Okay. So it's not going to be like gonorrhea, chlamydia, where you take some antibiotics and it goes away. This is a virus that stays in the body for life. So it doesn't, right now, there's no vaccine, there's no medications that can cure HIV, but we have medications to keep it under check. And you can go by and live your normal life, like your normal, healthy life. So another thing that that kind of plagues us here would be non-adherence to medication. As long as you're taking your HIV medications, you are going to be fine. But if you take and you stop, you take, you stop, or you decide, hey, I don't want to take this medication, then the infection is going to progress and progress to the point of AIDS, which is that end stage of HIV that we talked about. So, what is stigma? I've talked about it a little bit. So, it's a mark of disgrace associated with a particular circumstance, quality, or person. In this case, we're talking about HIV. And then, discrimination when, you look at, based on perceivable characteristics that serve to basically distinguish people from other members of a society. So, this is something that people believe that only certain groups of people can get HIV. Absolutely not. Anybody can, and I can't stress that enough. Anybody can contract HIV. And then making moral judgments about people who take steps to prevent HIV or feeling that people deserve to get HIV because of their choices. This is absolutely wrong, and I cannot stress that enough. So these are some of the common examples of what HIV discrimination would look at when people distance themselves from someone living with HIV or socially isolating a member of the community because they are HIV positive. And this is disheartening on every level. But I do feel that this is partly due to the fact that we don't have that knowledge. One of my favorite passages in the Bible says, my people perish for lack of knowledge. And I feel like that's what actually affects us, at this day and time, and this age where we are, and all that, is that people actually do not understand this infection. You think by sitting next to somebody with HIV, you're going to contract the infection, or by kissing somebody, or hugging, or sharing, your basic utensils, that's your, fork, knife, and all that, you're going to get HIV. Absolutely not. So we need to educate ourselves more. So I am so happy that Ms. Bettina and her group, they are doing these things to share, heart disease, HIV, all these things that plague our communities. Is so important that we have the right information. There's so much misinformation out there. All right. So, what are the effects of HIV stigma and discrimination? Where does the stigma comes from? Back in the 80s when HIV was new, and we had all these horrible stories about people. Things are completely different now, and the lack of information and awareness, and the outdated beliefs. They say, hey, if you get HIV, that's a death sentence. Absolutely not. It's not a death sentence. You would live your normal life if you do the right things, which would be taking your medications, living healthy, exercising, dieting, doing all the right things like everybody else. You will be just fine. So, but people don't think about the effects this have on other people. But again, we're going to address that with Mr. Galloway. All right. So, what can we do? Educate others about HIV. All right, which is what we're doing right now. So that's why I'm so honored to be part of this, because this is something I do on a daily basis, and I'm very passionate about that. And being around people with HIV and talking with them, it kills me to hear these are the things that they have to go through every single day. People looking down on them, or being judgmental, or being discriminated about. So the most important thing is what we're doing right now. Let's talk about it. Let's talk HIV together. You have to know your status to be tested, or to get on medications. So let's talk about treatment. This is what I was actually walk everybody through the process, and then we can get to the treatment part. So now let's say someone gets tested and your HIV is positive. The first thing is going to be, oh my God, people are going to freak out, right? Do not freak out. Help is there. There's treatment. This is not, the way it was in the 80s where, there was nothing, or you have to take like 20 pills every day. Now there's so many medications available, all right? And we're able to get anybody who's HIV positive and put them on medications. There are different classes of HIV medications. We have, what we call the PIs, the non-NOx, the NOx. I'm not going to go into this, that's a little bit for the medical, professionals, but I want you all to know that we have different classes of HIV medications that we can put you on, or put, somebody on. The class that we use, the choice of medication depends on, the risk factors, other comorbidities. Does that person have diabetes, hypertension? Just some medications that might work for, certain a group of patients, and it will not work for the rest. What is your race? We have to, do certain tests, especially for the African American communities, and see, hey, do you have, what we call like G6PD deficiency and stuff like that. So there's a whole bunch of stuff that we as providers do behind the scenes to come up with the right regimen. And so what do we do? These days we have multiple medications that come like combined, 2-3 pills in one pill, 2-3 medications in one pill. So all you have to do is take one medication a day. And we want to start as soon as possible, right? Regardless of what your CD4 count is. What is CD4 count? This is the test that we do that tells us how much the virus has destroyed your immune system. So the CD4 is part of that immune system that helps us fight infection, right? And as I mentioned earlier, the infection works by destroying this immune system. So we check your CD4 count. That would tell us how much the infection has progressed and what we need to do. Sometimes we have to put, that person, if that person has AIDS, we have to put them on what we call opportunistic infection prophylaxis. And these are basically antibiotics we're going to put you on to protect you from contracting what we call opportunistic infections. These are infections that under normal circumstances, your body can ward off, but when your immune system is low, then it becomes a problem. So we put you on these medications to protect you from contracting any of these other infections going around till your immune system is strong enough to fight for you, and then we get you off those medications. HIV medications is something you take for life, just like if you have hypertension, if you have diabetes, if you have heart failure, other medical conditions that you have to take your medications for the rest of your life. So that's kind of how HIV medication works. And then, medication compliance, I had talked about it earlier. You got to be on your medications and take it daily. Okay. And then we as healthcare providers will always monitor for side effects. So let's talk about PrEP. What is PrEP? This is the pre-exposure prophylaxis, and we tend to give this if somebody's high risk of contracting HIV. So let's say that you are in an intimate relationship with somebody who is HIV positive and is not uncontrolled, then you might want to get on PrEP. Your healthcare provider will be more than happy to put you on this medication. These are basically HIV medications that protects you from contracting the infection. Or if you are in a sexual relationship with somebody, you don't know their HIV status, they may or may not have HIV, they don't know, you might want to protect yourself by getting on PrEP. Other risk factors or other people that would benefit from this would be if you have multiple sex partners and you don't know with unknown HIV status. If you've had other STDs in the last 6 months, it kind of puts you at risk of contracting HIV. And then if you share your needles, if you're an IV drug user or other medical conditions that you have to inject medications and you share your needles, then you will be a candidate for PrEP. One important thing is that before you get on PrEP, you must be HIV negative. So if you come to the doctors and come and say, hey, Dr. Animalo, I think I have risk factors. I want to see if I can get on PrEP. The first thing I'm going to do would be to check your HIV status. If you're negative, then I can comfortably put you on PrEP. If you are at that point HIV positive, then we can't do PrEP anymore. I just have to put you on their full-blown medications for HIV to make sure it does not progress. Then post-exposure prophylaxis, this is what we do after a suspected exposure. So if you come to me and say, hey, Dr. Animal, or you go to the nearest ER or to your doctor's office and say, hey, I feel like I may have been, exposed to HIV. Maybe I had sexual intercourse with somebody. I don't know their HIV status. Well, I'm going to be like, okay, I'm going to put you on PEP, which is the post-exposure prophylaxis. We normally do this for 28 days and keep testing to make sure you're negative. Or it could be a healthcare provider, myself included. Maybe there's a needle prick injury, and I don't know if the patient is HIV positive or negative, or you don't know the status. And then we're going to go ahead and put you on this medication, which is also a type of HIV medication, in an attempt to protect you from contracting this infection. So I'm going to stop for now, and we will take questions at the end. Thank you.
Thank you so much, Doctor, for your presentation. And as you said, we are going to hold off questions until we hear from Mr. Galloway. So Mr. Galloway, Denford Galloway was born January 3rd in 1961 in Memphis, Tennessee. And he is not a stranger to us. He has been with us at least once before, but for those of you who don't know him, he has 6 living siblings. He states that he's an African American and has been living with HIV since December 5th, 2003. He is currently the Planning Council Manager with the Shelby County Health Department's Ryan White program for the greater Memphis area. And he is a certified in substance abuse counseling and is a volunteer mental illness teacher for the National Alliance of Mental Health. Denford is also a veteran who served in the U.S. Army. Again, we want to welcome you. And we want to start, first of all, before I start asking questions, I do want to acknowledge the fact that, did you not receive an award on World AIDS Day? Can you kind of just share a little bit of what that was about?
Yes, good morning, everyone.
Good morning.
Out there. Yes, I received the award World AIDS Day, which is the day that nationally was recognized for HIV across the world, not just the United States, but the world. But I did receive an award from Sister Reach, if I may call their name, for being a voice in the community with HIV. So I'm proud of that, and my job is my life.
And you should be. So my first question for you today is, how has living with HIV shaped the way you see yourself and your life's purpose?
Well, transparently, originally when I first contracted HIV in 2003, it wasn't an easy road for me. So basically, I felt like I was in a state of depression, isolation, and felt like I wasn't worthy. Embarrassment comes along with that. But I would say the last 7 years since I've been a planning council manager, it have kind of thrust me into a new positive life. The way I see myself now is someone who's confident, someone that's willing to share my story to help others, and not worry about what people think about me, not worry about the negative, as Dr. Animal said, the stigma surrounding HIV. So I see myself in that way, and I feel like I have a purpose in life. And my purpose is to live a long, healthy life. But my number one purpose is to help the community and others across the United States be educated about how not to contract HIV.
Wow, thank you. So what has helped you stay grounded, hopeful, or resilient on your journey?
What has helped me stay grounded? I would say my spiritual life, number one, has definitely helped me stay grounded, because without that spiritual life, HIV is not an easy thing. Life is not easy, matter of fact. So add HIV on top of that, okay? And I look for no sympathy, but what has helped me stay grounded besides my spiritual life is the fact that I want to live a long, healthy life. And to do that, I have to, number one, take care of myself and know how to take care of myself, okay? But the main goal again is that just to be able to show others that's living with HIV that they can live a positive lifestyle, okay, and to help others not to be able to contract HIV. So that's what has helped me stay grounded, knowing that there's people out there that need to hear my story, people out there that need to know that, hey, HIV is not a death sentence, and to know that they can still be involved in sex but be safe.
Wow. So you just really highlighted the importance of mind, body, and spirit in order to be whole and healthy. And now, thank you for that answer. So, what do you wish more people with HIV, more people understood about living with HIV today?
Number one, I wish people definitely understand that HIV is no longer a death sentence. It's not. But even though it's not a death sentence anymore, if you don't know your HIV status, it can be. So we have a slogan, know now, live longer. So I want people to know that if you know, you can live. If you know, you can know how to prevent contracting it. But if you do contract it, you still can live. So if you know, you can live. Other than that, I wish people would know that people living with HIV are normal. They are human. Okay, and they do have feelings. And Dr. Amalo spoke about stigma so much, and that is a key part. It's a key part in more than just one way, because stigma can keep a person from knowing their status. Stigma can keep a person from wanting to get tested. And we can't allow that, because more people will be harmed. More people will die if they don't know their status. So we need to treat people as human, and so that they can know their status. People living with HIV are no different than anyone else, because everyone, I say everyone, I must stress, everyone is HIV possible. That word possible, that means that everyone can possibly contract HIV.
Wow, you said a lot. And so everyone is HIV possible. I love that because as Dr. Anula said that HIV is no respecter of persons. It's about the behavior that you engage in and how you engage in that behavior that puts you at risk. And so thank you so much for sharing that. So let me ask you this. What moment of experience have you been excuse, I'm sorry, that's what we did. If you speak directly to someone who's newly diagnosed, what message or encouragement or wisdom would you like to share?
I speak to someone that, and I have spoken on numerous occasions, someone that has been newly diagnosed, and it is a devastating moment. It is, because I can recall when I first was diagnosed, I went into shock. Okay, so what I would tell someone that's newly diagnosed is life is not over. You can live with HIV. Yes, it's gonna be hard. It's gonna be some depressed moments. It's gonna be some time when you feel alone. It's gonna be times when you are scared to even talk to someone, to have a relationship. Okay, so I just want them to know that life continue on. You can live a long, healthy life. You just need to stay in care. You need to be around people that has experience living with HIV. You need to be able to take control of your own life and don't let HIV, yes, you may have HIV, but HIV don't have you. Okay. Not only that, I try to be that role model for them, just to let them know that, hey, you can still be the CEO of your own life. You can take control of your own life. You can still have a career. So life doesn't stop. Life continues on, and you can live a long, healthy, normal life.
It's pretty powerful. I've been working in the field of HIV since 1992, and we have come a long way. We have
Mhm.
come a long way. And I, I'm just so proud that you have such a positive attitude and that you are willing to share, because so many people, it's still a stigma, and so many people can't even share it with their own family, let alone come on a webinar that's going out nationally to talk about their status. And so thank you so very much for being brave enough to come on and talk about it. And I want to say that Dr. has given us a wonderful scientific overview of what HIV is and a medical overview. And then you've put the human face to it. And so we are so very glad that both of you chose to come on today and to share with us. And so before we open up for questions, I did again want to encourage everybody to share today's webinar in your social media networks. I want you to feel free to post questions or comments in the Zoom chat, or if you're on Facebook or YouTube, to feel put them in the comment section, and Mr. Robinson will read the questions off to us so that we can make sure that everybody's questions are being answered. If you are on Zoom, you can either use the chat, or you can raise your hand, open your mic, and ask any questions or make any comments that you might have about today's show. But before we get started with the questions, I did want to ask Dr. Do you, Mr. Galloway, have any one last burning thing that you would like to share with this audience?
Yes, absolutely. Again, thank you, Mr. Galloway. I love his passion. Like, we are also lucky to have him, and this is exactly what this, webinar is about, to let people know that, you can live your life, and, it's not as, what people think, and we need to understand a little bit more, and be able, it could be like it said, everyone, it's possible for every single one of us, incidentally, accidentally, any other way, but just to know that it's something that's out there, and it's not a death sentence, and you can go ahead, do your thing, live your life, be whatever it is that you want to be, and also understand, so that we stop with this stigmatization and discrimination that is part of what's killing us here.
Thank you.
I would like to give one burning thought process, is that getting tested, we must know. Of course, as Dr. Amal said, you said earlier, Ms. Cameron, that Memphis, we are up there in rising rates, new HIV cases. That's not good. But we got free resources, people that need to get tested. We have the free HIV take-home test kits, where you can do it in the privacy of your own home. Numerous places around Memphis, the Shelby County Health Department, Friends for All, Hope House, Labana CHIP program, they all do free HIV testing. In fact, some of these places, especially like Labana and CHIP, they will come to you if you're in fear of people knowing about you getting tested. But please know, if you are having sex, please get tested. Know your status. Know now, live long. If you know, you can live. So that's the most important thing. That's the first step, is knowing. Knowing is key. So go out and get that test. I don't mind anybody calling me for resources or what have you. So if you don't do anything else, know your HIV status.
Yeah, and one more thing, for, as we, Miss Bettina had talked about the statistics around, this area, the Mid South area, we're seeing children, 15-year-olds up until, 23, 24. And so parents, it's such an uncomfortable conversation to have, but, if our 15-year-olds, 15, 16, 17, 18-year-olds are testing positive, right? There's something we're not doing as parents. So I have children in that age group, and I know it's so uncomfortable, because when I'm like, oh, kids, let's talk about this, they're like, oh my God, mom, no, please, but we have to, overcome that hurdle and have these conversations with our kids. So parents, we have some responsibility to our teenagers, and, our early, 20 kids, to have this conversation, and also, enlighten them on what's out there.
So true, so true. So if you have questions now or comments, please feel free to open your mic if you're on Zoom, and to put your questions again in the comments section for if you're on Facebook or YouTube.
All right,
Hey, Ms. Bettina, we have a question.
Yeah.
It says, are PrEP and HIV meds as effective in people with previously diagnosed autoimmune conditions as in people without prior autoimmune condition diagnosis?
Yes, PrEP and HIV meds are equally effective in people with any kind of autoimmune, disease. Sometimes in patients that take certain types of medications for autoimmune disease, like biologics, there might be occasionally you have what we call drug-drug interaction, where some of the medications might interact with those drugs. And that's what we do. We will look at whatever medication somebody is taking for autoimmune disease and come up with the best regimen. Yes, ma'am. Or yes, sir. Yes, absolutely. It is equally effective, regardless of whatever autoimmune disease that person may have had in the past or still has. It doesn't matter. Who's to be able to get you on the right regimen for you.
Thank you. Any other questions, concerns that you'd like to share with us at this time?
There's another question for Dr. Adamalu. When does show TV air so Memphians can follow your show focused on infectious diseases affecting our community?
Okay, I'm gonna post it quickly. It shows on Mondays, and I forgot the channels. I'm gonna post it here, but it shows every Mondays at 6:30. The particular channels, I think it's 10:41. I'm gonna post it here before we end. And then you
Yes.
can also go to go to YouTube, Medical Class 901 with Dr. Chi. That's Dr. CHI. And I have so many videos on HIV that you can also look, where we talk about PrEP, and everything else. So you can also, the same shows we have on TV, on the TV shows, you'll also find on our YouTube channel, Medical Class 901 with Dr. Chi.
It's a wonderful resource. So I'm sure that once we get the information, we'll make sure that we also post it on our website so that people can have access to it, because this is what this show is about, helping people. Oh, I said one of the things of what this show is about is helping people to understand how the different types of health diseases and disorders, and how to best prepare to help themselves and their families to live a quality life within the spectrum if that's necessary. And first and foremost, to prevent, primary prevention, so that we don't have to live with these things. And so is there any other question? Are there any other questions or concerns, comments? Okay, so if they're not, we want to thank our presenters again for increasing our awareness about the disproportionate burden of HIV in our state and our community. We learned that the South has the highest rates of new HIV diagnosis, the highest number of people living with HIV, and the highest HIV-related death rates in the U.S. Most importantly, we were reminded that HIV is no respecter of person, that it's about the behavior that you engage in and how you engage in that behavior that puts you at risk. We learned that our role is to get tested, to know what our status is, and then if we are HIV positive, to get into treatment as soon as possible, because that may be what helps us to live a longer and a more quality life. So again, thank you so very much for sharing with us today. Kudos again to you, Mr. Denford Galloway, for being so brave and courageous as to share your story. So I want to do the final announcements for today. Remember that on the Mary and Pat Zoom webinar is Monday, February 23rd, and that's where they share with you on information about Medicare, Medicaid, Affordable Care, VA, all those different health insurances that are designed to help you and your family stay healthier and to live a quality life. So tune in again Monday, February 23rd at 6 o'clock. Let's talk about real estate with Area Mays is at 11 a.m. on Thursday, February 26th. And finally, I want you to remember that the next third Wednesday Parent Resource Chat will be held Wednesday, March 18th. And in support of National Kidney Month, our topics will be understanding childhood kidney disorders. We want to make sure that you encourage your friends, your family, your church members, your community to tune in, because the information that we are sharing on this just might save their lives. And it certainly will help them live a more quality life. So you may learn more about us on our website at www.healthytogethermississippi.org. If you have not already downloaded us and enjoyed the information or used the information that you shared, we invite you to please do so. Again, we are providing information through Healthy Kids Mississippi, Healthy Together Mississippi, so that you and your family can live a healthy life. Also, we want to acknowledge our executive director, Dr. Michael O. Minor, our program director, Sister Lottie Minor, and this has been a production of the Oak Hill Regional Community Development Corporation, empowering parents and strengthening families in the Mid-South region and across the state of Mississippi. Thank you. If you're on Facebook or Zoom, this is where we invite you to continue to have a wonderful day. And thank you for sharing this hour with us. And reach out if there are any questions or concerns that you have, or if there are topics that you would like to see us cover that we have not covered, or you think we may not cover, but that are important to you. Please reach out to us. If you're on Zoom, we're going to invite you to stick around for another 5 minutes or so while we sign off, and continue to ask any questions, entertain any questions or concerns you may have. Again, thank you.